USMLE style question. Achondrogenesis type 2. A 22-year-old woman, gravida 1, para 0, undergoes a routine second trimester ultrasound at 18 weeks of gestation. The examination reveals severe micromelia, a disproportionately large head, and a narrow chest with short ribs. There is also evidence of polyhydramnios. A detailed fetal skeletal survey shows poor ossification of the spine and long bones. Genetic testing later confirms a mutation in the COL2A1 gene. Which of the following best describes the primary defect associated with this condition? A. Impaired endochondral ossification. B. Defective osteoclast function. C. Abnormal intramembranous ossification. D. Impaired WNT signaling. E. Defective synthesis of type 1 collagen. Answer and explanation. Correct answer. A. Impaired endochondral ossification. Achondrogenesis type 2 is a rare, lethal skeletal dysplasia caused by mutations in the COL2A1 gene, which encodes type 2 collagen. Type 2 collagen is a major component of cartilage, and its deficiency leads to defective endochondral ossification, the process by which cartilage is replaced by bone in the developing skeleton. This results in severe skeletal abnormalities, including micromelia, short limbs, poor vertebral ossification, and a narrow thoracic cavity, which can cause respiratory failure after birth. Choice B, defective osteoclast function. Incorrect. Osteoclast dysfunction is associated with osteopetrosis, a disorder characterized by increased bone density due to impaired bone resorption. Choice C, abnormal intramembranous ossification. Incorrect. Intramembranous ossification forms flat bones, e.g., skull, clavicle, which are relatively preserved in achondrogenesis type 2. Choice D, impaired WNT signaling. Incorrect. WNT signaling plays a role in osteoblast differentiation and bone mass regulation, but it is not the primary defect in achondrogenesis type 2. Choice E, defective synthesis of type 1 collagen. Incorrect. Type 1 collagen mutations cause osteogenesis imperfecta, which presents with fragile bones and frequent fractures, not the severe skeletal hypoplasia seen in achondrogenesis type 2. Key takeaways. Achondrogenesis type 2 is due to COL2A1 mutations, type 2 collagen defect. It primarily affects endochondral ossification, leading to severe skeletal hypoplasia. Ultrasound findings include micromelia, poor vertebral ossification, and a narrow thorax. It is a lethal disorder, typically resulting in perinatal death due to respiratory insufficiency.